So here's one of the things that I can share with you. I've seen a master class in what not to do in recent months in this area. If we're looking to increase revenue, the reality is we have two options. We can increase the number of patient encounters, and we can increase the production per encounter. Okay? We might be able to do one or the other. Sometimes we can do both. Okay, so here's the misstep that I've seen. There are people out there, experts, that will actually tell you that to increase patient encounters, you need to dramatically shorten our appointment time in hygiene. Okay, is this increase sustainable? So I call this accelerated hygiene. Very different in my mind than assisted hygiene. Accelerated hygiene really expects our hygiene team to perform a world-class experience in a dramatically reduced amount of time. And what I've seen with this is an adaptive strategy designed to increase revenue by artificially increasing volume, and in some ways it's designed to minimize the pain of canceled appointments in hygiene. Okay? Many are falsely led to believe this is the best, most efficient way to increase hygiene revenue. And what I've seen is hygiene appointments being slashed to 30, 40, or 45 minutes. Can you really provide a world-class experience in 30 minutes? Oh, somebody might be able to do it, but I certainly can't. I think my standard for what I want our patients to receive is different. I just don't see this as a long-term strategy that's a winner. Okay, so again, it may increase revenue in the short term, but what does it really do in the long run? Is this sustainable? I have not seen it be an effective strategy over time. And here's why. Shorter patient visits or accelerated hygiene reduces our ability to provide that world-class experience. We have less opportunity for education and building value, which leads to increased chance of errors and missteps. One of these practices said, we don't probe. We don't have time. And interestingly enough, they had done zero quadrants of scaling and route planning in the entire previous year. Okay, so again, errors, missteps, liability. We've seen, because the experience is poor, we've seen an increase in cancellations and no-shows, which affects the long-term growth and sustainable success of the practice. Okay, but if we are looking to increase hygiene revenue, we might be able to increase the number of encounters with an assisted hygiene model. Done well, this enables us to have the best of both strategies. Okay, but caution, this strategy certainly will not work for everyone. It's one of 3 models of hygiene that we teach. If you're out of doctor capacity, this is the absolute last thing you should do. So you have to be careful here. I probably should have told you that before no, I'm just kidding. But no, honestly, it is tough if you're out of doctor capacity because we've just increased the number of exams that are required. Okay, so the other option is to increase production per encounter. We're talking about leverage here, right? This is our opportunity to leverage the opportunity we have with each patient and do more for them. So this is where we see practices double their hygiene production. They're leveraging the time that they have with these patients. And by the way, this is by far the most effective strategy when you're accepting reduced fees and participating with PPO and insurance plans. Okay, increasing the amount of revenue per appointment. And we do this by maximizing 3 roles at a high level. Same-day prevention, high-level conversations that help patients move forward and make progress in their oral health battles. We're directly involved in utilizing technology and building value and driving restorative services. We're leveraging that hygiene appointment. We're focused on patient engagement, building value for hygiene services and establishing long-term relationships. Okay, that's how we leverage hygiene. I have not seen accelerated hygiene be a successful long-term strategy. Instead, let's leverage the time we have with hygienists and do more with the patients that we serve. Okay, so with that, how do successful practices leverage resources? This has been an interesting shift that I've seen, and to be honest with you, it's one of the reasons we have one of the speakers that we do on our schedule. An emerging trend is utilizing outsourced help to help bridge the gaps. streamline tasks, gain traffic time for important phone calls and other elements that we may be in need of in our practice. We are seeing practices leverage the impact of online reviews to help drive new patients. That's a powerful tool. We're leveraging outside companies to provide services that enable owner doctors and producers to preserve mental energy by doing things that can be outsourced. What do multiple locations leverage? Well, they leverage pretty much everything. We see multiple locations able to leverage marketing dollars. They're able to negotiate PPO fees and be far more efficient than the solo practitioner in today's world. They're negotiating supply costs and lab costs. They often leverage administrative services. They may have a call center. They have an insurance center. They may have, a resource for team support, and they're certainly leveraging knowledge, the knowledge that exists within their organization and the group that they participate with.